Magandang hapon, Malacanang Press Corps. Narito si Press Secretary Trixie Cruz kasama sina Dr. Beverly Ho at Dr. Albert Domingo ng Department of Health.
Magandang hapon. Nagkaroon kami ng cabinet meeting nitong umaga, 9 o'clock. It was a special cabinet meeting. Ang pinag-usapan po namin ay tungkol sa budget. Nagpresenta po ang Department of Budget and Management at ipinakita yung proposed submission for Congress. Pagkatapos ay may mga konting input galing sa iba't ibang mga kalihim para sa fine-tuning na ito. Makakapagsumite ang department sa Kongreso on time by next week. Bahagi din po dun sa mga diskusyon ang balik eskwela ng Department of Education. Kinongratulate po si SILG, Secretary Benhar Abalos doon sa 60 kilos na drug bust na ginawa sa Pampanga. And also, ang pagdiskubre natin na mayroon tayong unang kaso ng monkeypox. Gumaling na po yung tao. Nandito po yung DOH. Explain po namin yung why monkeypox is not like COVID. It's primarily the DOH should be in a better position to discuss. So, gusto niyo mag-discuss muna yung DOH before you ask your questions? Alright, dali lang po. Doc? Dr. Beverly will be discussing the matter with you.
Thank you, Sec. Yes, ma'am. I'll be reading the DOH statement. The DOH detects the first confirmed case of monkeypox in the Philippines. The Department of Health has detected the first confirmed case of monkeypox in the country. The case is a 31-year-old Filipino national who arrived from abroad last July 19. The case had prior travel to countries with documented monkeypox cases. The case was tested and confirmed positive for monkeypox via reverse transcriptase polymerase chain reaction or RT-PCR done at the DOH Research Institute for Tropical Medicine on July 28. The case has been discharged well and is undergoing strict isolation and monitoring at home. DOH has completed its case investigation and identification of close contacts. 10 close contacts were recorded, of which 3 were from the same household. All have been advised to quarantine and are being monitored by the department. The DOH assures everyone that our public health surveillance systems are able to detect and confirm monkeypox cases. Monkeypox is caused by a different microorganism. It's different from COVID-19. Investigation of recent monkeypox cases in other non-endemic countries indicate potential transmission through sexual contact. It spreads mostly by intimate sexual contact with those who have rashes or open lesions. It is not like COVID-19 that spreads mostly through air. While it is now a public health emergency of international concern, everyone can actually help prevent and the spread of monkeypox. We minimize close sexual contact with suspected cases, especially those with rashes or open wounds. Keep our hands clean, wear face masks, cover cough using our elbow, and continue to choose areas with good ventilation or airflow. The DOH also wishes to emphasize that while anyone may get it, but if you have travel history to countries with monkeypox and then have symptoms like fever, lymphadenopathy or kulane, and rashes, that's the time that you need to seek medical attention. This will help hasten recovery. For more information, you may access our materials. Please access it through an online folder bit.ly/monkeypoxfacts, that's one word, with capital M and F. That would be all, Sec.
You have questions? Pia Gutierrez.
Okay, Dr. Beverly Ho po. Ma'am, what is the condition of the 10 close contacts? Are they exhibiting symptoms of monkeypox?
No symptoms for the current close contacts. That's why they're all on quarantine still. They're being observed.
Ma'am, what symptoms were exhibited by the first case of monkeypox at bakit po ngayon lang po na i-report, ngayon po na naka-recover na itong case natin?
Well, as we have mentioned, the patient was tested and confirmed yesterday, July 28, but we will not be divulging any more of the clinical information because that's all within the purview now of the specialist who's looking at them.
Leigh Alves, GMA7.
Hi, Doc Bev. Doc, ano po yung gender? May we ask for the gender of the first detected case?
I think we will not go into that, but as long as you know that the patient is a 31-year-old Filipino national.
And ano po yung travel history niya? Saang bansa po siya galing?
All we can say is that the patient traveled to areas with confirmed cases of monkeypox that are typically non-endemic areas.
And dumaan naman po siya, Doc, sa screening no, when he arrived at the airport.
Yes, dumaan po sa screening, but we all know no that the symptoms do not necessarily come out earlier, 'di ba? Yung iba much later.
Thank you.
Maricel Halili, TV5.
Doc, good morning. Ma'am, just to remind lang po the public, ano po yung SOP with regards po sa monkeypox? Like yung mga yung naging close contact nung case, gaano katagal yung kanilang quarantine, and paano po yung nagiging screening ng mga arriving na Filipinos? Kailangan may symptoms muna before undergoing sa test, ganun po ba?
Yes, no. So basically, for the close contacts of this case, as with any other cases, based on our guidelines, you need to quarantine for 14 to 21 days, no, based on the onset of your symptoms, no. So we'll just need to observe them for that duration of period kasi doon yung pwedeng lumabas. As to passengers coming from abroad, some of you who might have traveled would note that the Bureau of Quarantine One Health Pass, it also asks screening questions about monkeypox. So that's the first line. Second is fever nga yung isang symptom, di ba? So meron pa rin tayong mga temperature screening na available sa airport natin. Then of course, yung mas hindi lang makikita, no, would be the rashes, 'di ba? Kasi kung naka-long sleeve yung pasahero, no. But efforts are ongoing now para matingnan, no, kung mga naka-jacket, pwede silang papatanggal yung jacket. But then this would be probably the most difficult to screen from afar.
Ma'am, at least maybe know kung saang area po yung case.
All we can let you know now is the case is recovering well at home. I think we wouldn't be divulging any more information other than that.
Thank you, Doc.
Dr. Ho, question from Job Manahan, ABS-CBN Online. How soon can we avail of the smallpox vaccine or vaccines for monkeypox? And sino po ang priority na makakakuha nito if ever?
Well, now our discussions are ongoing. I think we've mentioned it in our previous press conferences that we're working with the U.S. government to secure the vaccines. There's not a lot that's available in the market. Also, that it's only a select population group that will have to be vaccinated. Again, it's not like COVID that all of us need to be vaccinated.
Follow up from Job. Is DOH prepared to contain another global health emergency like monkeypox?
Our systems are in place. But we all need to work together. We need also the public to be vigilant, particularly the key population groups who are at most risk. And based on what we know about monkeypox, lifestyle, no, there is a very clear need to be more careful about who we interact with, particularly sexual, intimate contact. So I think what is clear to us is we're working closely with those population groups so that they will have better preparation, risk perception, that this is a disease that would probably concern them more than the general population.
Any other question for Dr. Ho? Thank you very much, Dr. Ho. Entertaining questions for
Any more
Secretary
questions?
Angeles.
Okay na tayo? Yes, ma'am.
Pia Gutierrez.
Ma'am, yung sa sinabit po na proposed budget, ano po yung mga priorities po?
Well, topmost, of course, is still the right sizing, but the same priorities hold true. The Constitution requires the biggest budgetary allocation for education, so it's still the same. Hindi po masyadong nagbago from last year. I would like to remind you that most of the budget was created by the last administration.
how much po will be allocated for the country's COVID-19 response?
Ma'am, we don't have details kasi fine-tune. The presentation was for today so that the secretaries can fine-tune their particular budgets. It will be finalized and then submitted to Congress next week.
Thank you po.
Yes, ma'am.
Cresilin, SMNI. Ay, sorry.
Ay.
Sorry. Yes.
Ma'am, hello. On another topic po, is the President po going to certify the the bill for the creation of the Department of Disaster Resilience po?
The President merely talked about it last time. We'll have to wait for him to put in writing if this is going to be a policy directive.
Lastly, ma'am, from my end, yung meeting po ni PBBM with Solgen and Chief Presidential Legal Counsel the other day regarding the ICC po. Sabi po ni Solgen, meron daw po sila na pagkasunduan doon sa pulong. May we know kung ano po yun?
There are no details out about it yet.
But the meeting itself, ma'am, was it because po yung order ng ICC na mag-comment po yung Pilipinas regarding po sa
We have no details, so we don't even know what the topic was about.
Mela Las Maras, PTV.
Secretary Trixie, ano lang po yung mensahe ng Malacanang sa publiko ngayon ngang may monkeypox na may mga paalala at ano po kaya yung reaksyon din ni Pangulong Marcos nito nga sa monkeypox?
Well, first of all, it's only one case, number one. Number two, as you can see, it doesn't affect the entire population. Number three, this is not like COVID that can be spread by air very easily and could possibly be fatal. This is not particularly fatal. But it is of concern. So his primary concern was to get the information out so that people will be aware, but also to be aware that the systems of the DOH are in place and that this is not the same as COVID.
Vance Fernandez.
Ma'am, good afternoon. The DOST on Thursday made a statement urging President Marcos to strengthen the program, Balik Scientist Program, to lure back scientifically educated individuals back to the Philippines through employment and opportunities and allowances. This opens the entirely new question on how the President plans to deal with Filipinos of all professions choosing to work abroad over here at home. What economic and employment programs does the President have in line to grant Filipinos better career and financial opportunities here at home to help the economy rather than living for another country?
The primary program is to get the economy back on track post-COVID. So a good economy, a thriving economy, is going to help bring back all Filipinos. So that's the primary goal right now, as was mentioned in the SONA. For particulars regarding our Balik Scientist program, we'll have to wait since the call has just been recently made.
Alvin Baltasar, Radyo Pilipinas.
Secretary Angeles, magandang hapon po.
Magandang hapon.
Secretary, napag-usapan po ba yung susunod na magiging alert status since tayo ay July 29 na malapit na yung August 1?
Susunod na
Alert
status.
level.
That will be called by the DOH, so we will have to wait. Anyway, they do right now it is status quo, so we'll maintain the alert levels for now. But the entire process is also continuously under review, so we have to wait.
So we expect announcement siguro bago mag-August 1 po.
Yes, sir.
Follow up lang, Secretary. Is it true na hinire po ni Pangulong Marcos si dating presidential spokesperson Harry Roque na maging private counsel to the tune of 20 pesos?
Well, as you know, any communication between attorney and client is privileged and therefore confidential, and therefore we cannot even confirm whether or not he has been hired as counsel. That will be really up to the client to make the announcement, and no such announcement has been made yet.
Salamat po, Secretary.
Secretary, last question from Pia Gutierrez.
Hi, ma'am. Ma'am, ako ulit. So, ma'am, may we know if the Marcos administration already has plans on what to do with the PCGG? Kasi si Justice Secretary Boying Rimulya says he wants to expand the mandate of the commission to go beyond recovering the ill-gotten wealth of the Marcoses. Is this going to be the direction of the Marcos administration po?
Since it is Secretary Remulla who has made the proposal, we'll have to wait for him to bring it up. So right now, there is no policy.
Pero ma'am, as early as now, what does the palace say to those who are concerned that the Marcos administration will either abolish or dilute the mandate of the PCGG?
We don't respond to speculation, ma'am.
Thank you po.
Okay. All right. Now, thank you, everybody.
Maraming salamat, Malacanang Press Corps.